Jeff Slauson here from 19 News Now at the 19 News Digital Desk. We went through a couple of months where we were giving you daily, essentially, COVID-19 updates. We've stalled on that a little bit, but we want to bring you the latest ones at least today, because traditionally what we see during the holiday season is an increase in cases, and that is what we are trying to prevent here as of right now. So these numbers just got updated today. They update on Thursdays, and as you can see on the top right hand corner of your screen there, this courtesy of the Ohio Department of Health. The last update was today, 12/29. So what exactly are we looking at here? Well, fortunately, we are looking at less cases, less hospitalizations, less ICU admissions, and less deaths. What we are seeing, at least for the 3-week trend, which is what we typically like to look at here, is a dramatic decrease from cases last week over this week. So that was 17,891 cases last week, down to 13,000 confirmed cases this week. The hospitalizations gone down as well. While not as dramatic, we still saw a decrease of about 60 cases week over week. In addition to that, ICU admissions, a decrease of about a dozen cases of ICU admissions, and we have seen a fairly strong decrease in deaths week over week. Now, deaths are a little bit harder to report because they don't report them daily, and it can be difficult at times for the coroner to determine if it was COVID or if they could be listed as just a respiratory illness, and that's why that number is typically a little bit more difficult to understand or to be an indicator of where we are. However, the strongest indicator, at least in my experience and the experience of the experts that we discuss and talk to, hospitalizations and cases. And seeing this decrease is a very, very important step. The change in cases, what you're seeing right there, that 13,047, showing a decrease in numbers. The average that we had over that time is still problematic, especially when you consider where we've been historically. So this graph right here shows you how many cases we've had total in the state, hospitalizations, yada, yada, yada. This is where we were last year, okay? Not even remotely close to that. However, we are still approaching this area right here where we had seen that increase in cases, and if you remember, August and September, we started to see some more cases there. Hospitalizations, that is where I want to kind of draw some attention to. We're approaching one of the highest level of daily hospitalizations since that massive spike at this time last year. Why is that so important to dictate? Why is that so important to kind of nail down right now? Well, the answer comes in the fact that we will typically see an increase in cases, typically see an increase in respiratory illnesses, typically see an increase in hospitalizations around the holiday season. The holiday season is when people are gathering, people are spending more time together, people are interacting more, people aren't wearing masks because they're out and about doing things. And that leads to more cases, traditionally, for a lot of these things. Let's go to the flu right now before we kind of get off on this here. The flu cases that we are seeing appear to be leveling off in part. I'm going to bring this full for you so you can get an accurate look at exactly what this is. Now the numbers that we are seeing here have not been updated since Christmas Eve, and we will not receive that update until tomorrow. However, I still think it's important to break these down for everybody as we head into New Year's Eve, New Year's Day, New Year's parties. Influenza-like illness outpatient data. So essentially cases that we are seeing down. That is a good thing. The state also tracks things like thermometer sales, which can be an indicator of people needing the thermometer because they're having a fever. Those have increased by 2.56%. You don't typically want to see that. But fever, down 6%. Emergency department visits, down 6.9%. A good number. However, as you're looking at these numbers that are seeing decreases, as you're looking at these numbers that are showing increases, you need to look at the peaks right now. What we're seeing, that blue line is the 5-year average. That orange reddish line, that is the current season percentage. You will notice an earlier peak when it comes to influenza-like illnesses, when it comes to fevers resulting in emergency department visits, when it comes to just general emergency department visits, and when it comes to hospitalizations as a result of the flu. We typically will see these increases. We typically will see these after the new year. In fact, what you're seeing right now, that data comes the week after New Year's last year, okay? The 7th of January typically is where we see some increases for hospitalizations. Right here shows us that the 31st typically sees increases, okay? That's the 31st of December. Where we are right now, we're about a week ahead of that. The concern for many officials, the concern for many in the healthcare industry was, when we hit this peak early, what will happen? How will this sustain? Where will this lead us to? We've never seen a peak this early. We've seen numbers this high, but we've never seen a peak this early. So what does that mean for the season? Well, right now we're actually seeing what that means for the season, which is a potential for a second peak. That's bad. But it also shows is a potential for us to see a rapid decrease, because traditionally when we have seen increases and the peaks hit, then we have seen some slow dramatic increases that have happened progressively, and we have seen those drop off fairly quickly. That's the hope right now. Now, we won't totally know what's going to happen. We won't totally know what the numbers are going to do until about a week out from now. Tomorrow we will get the latest data from the last week. Then next week, we will get the latest data from the week of New Year's. That is essentially the make or break moment where we will see what this influenza season is going to do. But I think it's really important to remember that this is no joke this year. This flu season is no joke this year. You're seeing just cases in general are up way more than the 5-year average. Confirmed hospitalizations up way more than the 5-year average. That is a problem. That is something that is needed to be monitored and not something to scoff at. Getting the flu vaccine is still an option right now. It takes about 2 weeks for it to become fully operational here. But that's still important, and that is still something that many people do need to consider when it comes to trying to stay safe, trying to make sure that they're staying healthy during this time, because you are going to be meeting with loved ones, you're going to be meeting with friends, family, you're going to be meeting with grandparents who could be put in very precarious, difficult situations when it comes to the case rate that we are seeing and how sick this can actually get you. But again, the question is going to be, when it comes to flu cases, the question is going to be, when it comes to these case rate trends that we're seeing for COVID, what will it do now? Because we are still kind of in the middle of that increased season. We are dead center right now in that time where we typically will see more cases of respiratory illnesses, including the flu, including COVID-19. So what this will do over the next couple of days will be incredibly indicative of what we will see over the next couple of months, how the rest of the winter will go, how much of a strain we will put on hospitals, both in the state of Ohio, in the area, and across the country, how many more people are going to get sick. That is what we can determine essentially from the next couple of days, and that is where we are right now, at a tipping point. Seeing the decreases in COVID-19 cases, that is a good thing. But seeing the increase in flu cases, that is a bad thing. And the COVID-19 cases, while they are not necessarily as high as they were last year, they're still significant enough to where it puts a strain on the healthcare system, and that's where the concern, that's where the fear does come into play. All right, so we are going to end this stream here, trying to get ready for our 3 o'clock news coming up in just a little bit. But we're going to be breaking this down quite extensively. Coming up at 4 o'clock, I believe, 4 o'clock and 6 o'clock, we're going to be discussing both the flu and COVID-19 cases that we are seeing in the state of Ohio, what this means for you, and how to keep yourself safe. Also at 3 o'clock, we will be getting our news of the day there. We'll have much more to cover on all topics that are ranging from COVID-19 to the increase in fires that we've been seeing, much more to hit on, much more to cover here on 19 News. But we will end our digital stream here. We will have much more, as I said, starting on CBS at 3 o'clock. For now, I'm Jeff Sloss with 19 News. Have a great night. See you in a little bit.
19 News, now streaming on Samsung Smart TV. Search for channel 1035.